Hi, I'm Dr. Brian Roadhouse, and I want to introduce my patient. Go ahead.
Hey, I'm Zach Lund. I'm 20 years old.
So, Zach's been a patient here at our office, and I just want you to kind of tell the symptoms or the problem that you were having before you came in to see us.
Basically, I had a large pain in the middle of my lower back that shot down through all the way down my leg. And it hurt whenever I sat in class. I couldn't sit through class the whole time. It hurt all the time, basically, unless I was laying down.
Okay. And did you have any weakness in the leg?
I did have some weakness. There was some definite differences in strength between my right and left leg.
Okay. And what about your posture when you came in to see us?
My posture was completely off, and I completely developed lopsided and was leaning to the left side.
Yes, so he's leaning to the left side because he had antalgic posture, trying to get away from the pain. Okay, so you want to tell us a little bit about some of the doctors that you went to before you came to see. Start with when it first happened in November, December, and you went to your family doctor.
First, I went to my primary care guy, and he basically, he gave me some pain pills to work with, and some muscle relaxers to see how that went. And that really took none of the pain away. And then he told me to go to a physical therapist. So I went to a physical therapist, and that made no difference either.
Okay, how long did you go to the physical therapist?
I went to the physical therapist for, I want to say, about a month.
Okay, so now we're probably getting into January and February. And what were the symptoms doing? Did you have any improvement?
Sometimes after physical therapy, if I did the the electric massage for a while, then right after, I would feel a little relief, but nothing, no healing at all.
Okay. And so the symptoms continued, and were they staying about the same? Were they getting a little bit worse?
No, they were getting worse.
Okay, all right. So then after you did physical therapy and that didn't work, did you go back to your family doctor at that time?
No, then I went to a spine doctor.
Okay, the orthopedic surgeon.
The orthopedic surgeon, yes.
All right. And he's the one that diagnosed you with myofasciitis,
yes,
which is inflamed muscles of the back. Okay, so then what did he do for you?
He gave me 3 shots. I think they were steroid shots.
Okay, in your back.
In my back,
okay.
Yes.
All at once?
No.
Okay.
They were about a week apart.
Okay, so what happened after the first one?
After the first one, I felt a little bit of pain relief and was kind of excited for a second, but that went away in a day.
Okay, all right.
And the second 2 didn't really make any difference.
Okay, all right. So then you finally, came into our office.
Yeah, then after that, I told him, I thought it might be anything more serious, and he said that he knew that it wasn't more serious than that, and he didn't know what to tell me, basically.
Okay.
And he said he could send me back to physical therapy if I wanted, but I'd already been there, and it didn't work, so I didn't go back.
Okay, so after going to all those doctors, when Zach and his parents came in, we did a consultation, examination, and in the consultation, I had a pretty good idea that he had a disc problem. So we ordered an MRI, and had quite a trouble with the MRI because he's in an HMO. The HMO insurance declined the MRI. We called your family doctor, and they thought it was a good idea, and they tried to get the insurance to cover it, and they wouldn't cover it. So anyway, we ended up doing the MRI, and your parents had to pay cash for it. So anyway, we get the results of the MRI, and you had a large herniation at L5S1. And then we did the neurological exam. And kind of, I guess, talking to your mom, you've had a little bit of tremor, a little trembling in your hand. And when you came in, you didn't even correlate the two. But then when we did the cerebellar testing, kind of tell them about, when we did the testing, and then after we did that treatment and how it affected it.
Well, he had me, do some cerebellum testing, and I put my legs together and closed my eyes and tried to touch my nose with my arms, and on my left arm was way off when I did it, and that kind of freaked me out. Then we did a vision test, and that was off.
Yeah, we did the temporal, the neurological blind spot, and he had a temporal blind spot, and so we showed him where the difference was there. And then we did a treatment and we tested him again. He's doing, and that's all the brain-based therapy, and real important in your case because anytime you do decompression, if the cerebellum is involved, it has to do with balance, coordination, and the spine muscles. And I explained to you that your muscles are tight. And normally, if you have a disc problem, you're going to have some spasm in the low back, but yours went all the way up. Yeah. And so it was on that one side. So we couldn't get a true decompression as long as that was there. So we did that. We've done the oxygen and the cerebellar treatments on you, and we've been doing the decompression. And you want to tell them how your results have been.
My results have been incredible. I mean, I have to get back to school in New Orleans. Well, I leave tomorrow, and I started this, how long?
About 5 weeks.
5 weeks ago, and I've been going twice a day, and I mean, I feel almost, back to normal.
Mm-hmm. Yeah, and the other thing is he's not antalgic anymore. You're not leaning to the side.
No.
You're not walking with a limp anymore.
No, I'm not working with a limp.
You don't have the shooting pains anymore.
I don't have the shooting pain. I mean, everything is.
And then he couldn't sit down at all either. And even 2 weeks ago, you were doing better.
2 weeks ago,
but
yeah,
sitting was still giving you trouble.
Definitely.
And in the last 2 weeks, you've been doing a lot better.
It's a lot better.
Okay, good. All right, Zach. Well, I appreciate you sharing your story because there's a lot of people just like you. You went to physical therapy, different doctor, orthopedic surgeon. Gave you a shot. A lot of patients have been through this, and then when you came in here, we did the proper diagnostics, we did the neurological testing, and you're a success story. So I appreciate you coming in, and good luck to you in school.
All right, thank you.
Okay, thanks.